really, and you're geared up and you take it, certainly it may be higher because of the stress of getting ready to go. Even maybe the stress of thinking about taking your blood pressure. But then, once you settle, then that is probably your normative blood pressure. That's why I think it's great. You don't trust just one reading. You take more than one. Excellent. Vessels to constrict as much as they need to be. So it could mean that there's something else going on, in which case seeing your medical provider would be really good, particularly if you know it goes down and you get dizzy, you feel it. We talked about hypertension being a silent killer, if you will, a silent disease. Actually, the opposite of it, the hypotension, we feel pretty easily. Our pressure goes down to a certain level, we're going to fall out, or we're going to feel dizzy or fainty or have problems with it. Does that help? Because it shouldn't do that. Normally, our blood pressure should hang out, about, up and down a little bit, but through the day should be pretty normal for us, whatever it is. Any other questions? Yes, ma'am. Yes, thank you, because I forgot to mention that. Indeed, all of those drugs that you saw, they can be used singly or they can be used in combination. And in fact, now the studies are showing that the more normal thing is to use either 2 or 3 or more if you need to reach a good blood pressure. So many people are on 2, 3, 4 blood pressure medications. If you're adding, you're usually adding from another class, like one diuretic, which now most people recommend that you try to start with that unless there's reasons not to, and then adding an ARB or an ACE inhibitor or a calcium channel blocker, or adding first an ACE and then a calcium channel blocker or a beta blocker. And actually, there are some protocols after heart attacks that actually require that multiple 2 or 3 are actually used. And is it because of high blood pressure? No, not necessarily, but it's because they actually help the heart work better. Does that answer your question? Good. Yes? No, ma'am. It is never, running above these levels that we talked about, if it's consistently above these levels, that might be normal for the individual, but it's abnormal, so it's hypertension. I'm sorry. I know, I'd like to consider a lot of things that happen to me very normal as well, but we need it checked out. Yeah, it may be what you always see, but it needs to be checked out. Each of us as an individual and our primary medical provider should be a great team. That's who we need to work together with, and whoever else we're sent to if necessary. We need to be a team. We need to dialogue. It shouldn't be just, one way. It should always be a discussion about what seems to be best, what ourselves as the patient feels is best for us and necessary, and what we choose to do. Because remember, what did we say? We're the only ones that can change our behavior. Any other questions? Yes? Oh, unfortunately, you would have to actually put a dipstick in it that would test for protein. There's really no way to necessarily look at the color. Usually if urine's darker and you don't have other medical problems that you know of, it's usually because you need more water. They say drink enough water that your urine's clear so that the urine starts looking like the water. That's kind of a good measure, but no, you can't really see the protein, but there are other things that cause protein in the urine, and that includes kidney disease by itself, of course the hypertension, And then actually some people, like runners, this will happen sometimes in kids. They'll run, and if you should have them check their urine right after running because they're beating their feet against the concrete, it'll actually spill protein in the urine. Mm-hmm. Yes? Indeed. Yes, that's an excellent point, that individuals who have diabetes will actually often be given the ACE inhibitors or the ARBs because these, most of the time, improve kidney function. However, as we discussed, there are a few people who are extremely sensitive to these drugs, and it will actually impair their function. So, how do you tell that? Well, you just check your blood work again in a couple of weeks, and no harm, no foul, you just come off of it. Most people take it very well. The problem that sometimes we run into, though, in treating individuals with medications that are also used for high blood pressure, and in individuals who do not have high blood pressure, but we're using it, say they've had a heart attack, and we're using it to improve the function of the heart, or they have heart failure, and we're using it to improve the heart in its contractions. Sometimes we can get into trouble because it'll lower the pressure too much. So that's a difficulty sometimes in using these agents when there really isn't hypertension. But they have been found to be extremely useful in other situations. Anything else? Well, please remember, each of you is your own health's best friend. No one can change anything about us but ourselves, especially when it comes to lifestyle modification. So please remember, treat yourself like you would recommend your best friend should be treated. Sometimes we neglect ourselves, but we never neglect our best friends. I appreciate your attention and your willingness to ask questions and your knowledge.